So this is an example in the congenital case of digital hyperextension deformities. So you can see like the weight is actually going on the joints, not the hooves. So this is a severe form, and in these forms, the foal walks on the palmar plantar aspects of the phalangeal region, and skin lesions basically can develop because that's not where the force is supposed to go. So it's possible for foals to be able to maintain their toes on the ground, and what you might see is, well, when they're standing, their metacarpal and metatarsal joints are angled more acutely than normal. And you can probably see this through x-rays more than anything. And the animals are reluctant to ambulate. And this is caused by flaccidity of the flexor muscles. And it usually corrects itself in a few weeks. But, of course, it's case by case, isn't it? So this is hyperflexion, so that you can see the hooves are going in. So this can cause dystocia. And sometimes when the foal is giving birth, sometimes the foal is unable to stand. This one can, but they step on the toe with excessive wear of the horn, and there's resistance of manual straightening if you do try to straighten the legs. And if the joint can be manually straightened, the prognosis is good without surgery, but yeah, I shouldn't have to do that. So we'll talk about the most common hyperflexion deformities. So it's usually metacarpal, metatarsal, flexural deformities, carpal flexural deformities. But yeah, you also have flexural deformities of the deep interphalangeal joint, I think that's what it is, and maybe proximal or something, joint flexural deformities, and tarsal flexural deformities. Okay, so in congenital flexural deformities of the carpal joint, what you can see is the foal can stand, but cannot completely straighten the carpi. The foal ends up being bow-legged because of this, or what you get is, let's say, how do I put this? The foal is bow-legged, or let's say over the knee. You see a straight pastern and normal hoof to ground contact, but and usually this problem occurs bilaterally. Now, if we talk about mild cases, it's usually self-correcting in, let's say, less than a week. Severe cases, they may be unable to stand, and the common digital extensor tendon may rupture. Now, with common, how do I say this? It says PIP joint, so I'm not sure if it means proximal interphalangeal joint or something. I'm really sorry. So many abbreviations that haven't been explained. You have flexural deformities, and they're rarely reported being involved in both legs, so it's usually only one leg. And you may see subluxation of this joint, so basically it might just pop out, or ankylosis of the PIP joint in more severe cases. And you'll see the dorsal surface of the pastern, so this side is not straight but convex, so it's sort of like a rainbow shape. The condition is changing, it appears and disappears when the animal is moving. So this is just showing you, by the way, ruptured common digital extensor tendon. What does that look like? So affected foals display, let's say, characteristic swelling in the tendon sheath. I don't know if it's very obvious. On the dorsal lateral aspect, so this is the outside of the carpus, you see the two ends of the partially or completely ruptured tendon can be palpated in the tendon sheath as well. Okay, so this is, again, ruptured common digital extensor tendon. So same thing, really. So the foal will appear kind of bow-legged with an over at the knees stance. Sorry, I can't say it, but that's what it looks like. And when they're walking, affected animals will throw their forelimbs forward and extend them completely and retract them slightly before contacting the ground. And a foal with a ruptured common digital extensor tendon often knuckles at the metacarpal joint during walking and might buckle in the carpal region while standing. Now, flexural deformities of the distal interphalangeal joint. Basically, so it shows you here, distal interphalangeal joint. Flexural deformities usually occur in foals between 1 and 4 months of age. It almost always affects the forelimbs, usually bilaterally. The dorsal hoof wall will assumes a more vertical angle, and the toe is under a lot of stress, which widens the white line and leads to a flaring of the distal hoof wall. The heels overgrow and the foot appears boxy, so it's sort of like this. There's no like clean angles. So this is flexural deformities of the distal interphalangeal joint. This is showing you first degree. Let's start here. So in stage 1, the angle described by the dorsal hoof wall and sole is greater than 60 degrees, but less than 90 degrees. So yeah, 60 to 90 degrees. In the second degree of flexural deformities of the distal interphalangeal joint, what you have is the dorsal hoof wall. Let me try and zoom in more, sorry. The dorsal hoof wall, so the outside, has passed 90 degrees and is beyond the vertical plane. So this was, the dorsal hoof wall here was 60 to 90. This is greater than 90. And yeah, in acquired cases of flexural deformity, let's say of the metacarpal, metatarsal regions, this is usually in 10 to 18 months of age, so they're usually more than a year old. And it's characterized by a straighter metacarpal angle. The foot usually appears normal and is in contact with the ground, but the pastern assumes a more upright position. You have 3 forms: mild, moderate, and severe. So the mild, that's number 1, the joint remains caudal to the foot at all times. So yeah, it remains behind it, let's say. So it has like a sort of angle, but it's straighter. With moderate, it's greater than 180 degrees of flexion. So remember that number, and it causes the metacarpal metatarsal joints in the moderate form to be dorsal to the foot when walking. So it means the joints are above the foot, so the legs are quite straight, and the horses can extend their joints to a position caudal to the foot. In severe cases, they're greater than 180 degrees of flexion again, but literally all the time. Sorry. Okay. So you can see the metacarpal joint knuckles are forward in severe cases. This is showing you mild and moderate. So if we just look back again, mild, so the joint is caudal to the foot at all times. So the joint is always behind the foot. Sorry. With the moderate case, it's greater than 180 degrees of flexion. The joint is dorsal to the foot. So the joint is basically above the foot, okay? All right, so let's stop here and we'll go more into acquired. Wait. Yeah, okay, because that was flexural deformities of the metacarpal metatarsal joints. This is going to be proximal interphalangeal joint.